welcome Thomas Wright from St. Louis, you have told me, and we are curious for your talk on Liposuction with laser radiofrequency plasma.
Yes, thank you for the kind invitation. Thank you for setting up this meeting. I don't know any German. I'm going to speak in English. I hope that's okay. So, yes, okay. Can everybody hear me okay? Yeah. Okay, so I just want to start with, there's really no evidence or no published reports of skin tightening in lipiding, and certainly energy-based skin tightening. Now, I also need to kind of preface this talk with the fact that there's some skin tightening naturally occurs after liposuction, and it's hard to estimate, maybe 10–15% of body skin surface area, which is really the best way to measure skin tightening, occurs just from liposuction. So we really have to pepper or kind of keep this in mind when we look at the data that I'm going to show you. So there's 4 different energy devices currently marketed for skin tightening: Vaser, laser, RF, and J plasma. And really, going through the literature, Vaser, while there are some reports of skin tightening with it, they're very conflicting. I really can't tell you that there's good evidence that Vaser leads to skin tightening. Laser, this again, I'm kind of picking the best studies I can find, showed up to a 17% skin contraction. That was measured at 3 months. Then there's the bipolar RF, which is probably the most effective skin tightening combined with liposuction. And this showed about 25% contraction at what range determined at 6 weeks, and maybe 36% at a year. And then possibly even greater skin contraction was seen on the arms. And they also looked not just at the body surface area, which is basically, with tattoo contraction of the markers. They also looked at vertical hang and saw some improvements. Renuvion, or is it J plasma? This is briefly a radiofrequency energy energizes a helium gas to make a plasma that then is spread throughout this subdermal area. And so this is reported with many independent observer of improvement in skin laxity, but there's really no objective data on it in skin tightening. Certainly not body surface area, just observer reported improvements in skin tightening. So obviously there's always risks with adding energy. The biggest risk is burns. If they're used properly, they're generally safe, but anytime, perhaps if they are left to dwell too long or the temperature goes up too high, you can have a burn. Obviously, there's a risk for eye injury with laser, and then the RF devices can interfere with medical devices or heat up metal implants. So those are all concerns. possible injury to lymphatics. This really hasn't been studied, but obviously it's a concern. So, limitations to the studies I showed. There's no head-to-head trials of efficacy, and obviously that's the best way to evaluate it. And only the laser and RF have body surface area contraction measurements reported. I already explained the limitations to Renuvion. Now, full disclosure, I have actually in my office all of these devices, and I do use them. So far, I have not, in lipedema, I have not used them on the legs. I use them on the arms, really out of just concerns. But really, it doesn't, I mean, again, as an owner of all three of these devices, I don't think it's really the car or the technology that wins the race. It's the driver that wins the race. And so in summary, skin tightening has not been studied in lipedema, but is used. There are no head-to-head trials of efficacy. The best data so far is on RF bipolar, and of course, we always should balance this with concerns for complications.
Thank you very much, Thomas Wright.